And good afternoon, everybody. I hope everybody had a good lunch. I am Russ Jensen. I'm the director of the Center for Service Innovation in the city of Knoxville, Tennessee. Within that center, we house 311, 211. We are part of the What Works Cities organization. We're one of the founding cities that went through the Alliance for Innovation's Innovation Academy several years ago. I also happen to be the statewide president of Tennessee AIRS, the Tennessee Association for Information and Referral Services, and we are part of the Tennessee Municipal Benchmarking Project. Next, please. Oh, you're already there. Never mind. No, my bad. Next, go ahead on to the next one. You can kick it to one more if you don't mind. Good news, bad news for everybody on the online. Russ has been up since about 4 o'clock this morning, getting ready for budget hearings with the mayor this morning, which means he's very, very caffeinated. That's always good news and bad news. So the good news is I am wide awake after lunch for our presentation. The bad news is I talk fast on a slow day. So with the amount of caffeine I've had, this may be one of the shortest sessions ever. And while the folks in the control room look at each other going, oh my God, I'm just kidding. But I am very happy to be here. This is the second time I've been invited, so hopefully I didn't goof it up too bad the first time. Just a little bit of bio information. I always like to explain to people where I'm coming from because that kind of explains some of my attitudes toward different topics. Although I live in East Tennessee and have for 20 years, I'm originally from Los Angeles, California. I'm a diehard UCLA Bruin, go Bruins, Sweet 16. I was a paramedic in South Central Los Angeles for nearly 20 years. And the reason I've got the one picture in the middle, the black and white picture, for those of you that are old enough to remember the old show Emergency in Squad 51, the gentleman that sits, he's squatting down with his hands on his knees. That was Engineer Stoker in the TV series. He was my fire captain at Los Angeles County Fire. So that gives you a little bit of idea how old I am. Been around the block a few times. Also played volleyball when I was younger and still had the knees to do it. Studied at the Soviet Sports School when it was still the Soviet Union back in 86, 87. Am a rehabilitating surfer, which you don't get to do very much of in the Smoky Mountain area. And then a couple of years ago, I fulfilled a lifelong dream of learning to fly. Had a myriad of experiences. I've been working with the city of Knoxville, built 311 for the city back in 2004, 2005. Was on the original 211 board back in the 2000s when we were the second one in the country to go live. Now 95% of the country has 211 coverage. 311 is strictly municipal services. 211 is more social service oriented. Combining the two has worked very, very well for our community. It's incredibly efficient. And this past year in particular, it's come in handy because the crossover of things we do has been spectacular, to put it mildly. On to the next, if you don't mind. During today's talk, and I'm going to switch it up a little bit, and I'll explain a little more here in a minute, especially when we get toward the end of the talk. But we're going to talk about some of the difficulties faced by many in a progressively digital world. We're going to list some challenges before, during, and after the pandemic. We're going to have some thoughts on ways to ensure inclusion, some examples of current attempts to address the digital divide. And at the end, this is where I'm going to switch it up. Rather than a kind of a traditional Q&A, I'm going to try to steal, for lack of a better word, ideas from other folks. And I know many of you are probably like me. When you sit through some of these presentations and you listen to them, you think to yourself, well, gosh, we already do this. Well, gosh, we already do that. Or we've tried something like this, or we've tried something like that. I'd like to hear it. I think when you get groups like this together, and it's been tough this last year, there are so many good ideas out there. So it would be a shame not to share them. Next, if you don't mind. Things change pretty fast. And when we talk about the digital divide in particular, it's kind of like news cycles. You know, it used to be news cycles ran a lot longer when it was just, 3 large networks, your major newspaper, and then, cable TV came along, and then the internet came along, and, the news cycle is now almost minute by minute. I remember when I was first EMS director for this county when I moved out here, we used to talk about how the news cycle had changed into a 24-hour news cycle. Well, now it's literally minute by minute, and you have to keep up. And I found this little cartoon when I was digging around online, and this guy that's sitting down so reminds me of me back in, I don't know, early 90s when we were first rolling out email and computer-aided dispatch and things like this. You know, you kids today with your cloud computers and your Google Docs, in my day, we attached files to emails, and that's the way we liked it. And the other guy says, Dave, you're like 2 years older than me. And Dave just kind of folds his arms and says, get off my lawn. That was me about 20, 30 years ago. So we have all had to make a lot of adjustments over the years to try to keep up. And in doing so, we want to make sure we've got everyone. So the next slide. And when talking about if we've got everyone, there are a lot of unintended consequences when you roll out new services, new tech, you change processes and procedures. Government is incredibly bureaucratic. Sometimes it's like trying to steer an aircraft carrier. But in a lot of ways, it's that way for a reason, because we want to make sure we are addressing the needs of the many and not just the needs of the few, to quote Dr. Spock. Next slide, please. But we can't help thinking when we roll out a new service or a new piece of technology, you know, and we're sitting there and we're like, did we forget something? Did we forget something? Did we forget someone? And then all of a sudden we have that Kevin in Home Alone moment, or Kevin's mom moment in Home Alone. Here in the city of Knoxville, we recently rolled out a new smartphone app. And our ADA coordinator, who, through no fault of her own, wasn't involved in the process early on because, again, everybody's so separated with COVID-19. But there were so many little details that she was able to think of for us that we don't think of every day. Because A, maybe we don't have disabilities, and B, that's not what we do for a living. And we do that all the time. Every time we change a process, I'm sure everybody out there has had one of those moments where you change the policy or procedure, or you brought in new tech, and then somebody came and said, well, yeah, but this person can't access it, or this doesn't work, or that doesn't work the way you thought it was going to. So we've all been there. We're all in the same boat. We're all on the same side. Next slide, please. And since many Americans were challenged to begin with, senior citizens, people with disabilities, people in low income areas, people in rural America, in our area, it would be Appalachia. And COVID-19 has literally magnified all that. When people started having to do the stay-at-home orders, or working from home, or services had to be changed from, for instance, I run a call center. Our job is to answer the phone. But when we had to work at moving people off-site, A, the way that phone travels to offsite can be a little challenging depending on your system. B, it may take a little longer. C, we're trying to get more and more people to do self-serve. And there are many, many people out there that are still getting left behind even before COVID-19. So you think of the poverty line, I want to say, and I had the statistics here, but if you are at the 30,000 annual income or less, kids in those households are only about 50% likely to have access to high-speed internet. So it's a coin flip, 50-50. You get to that $50,000 to $75,000 range annual income for a household, and you're up to 85, somewhere between 85 and 90%. So just that $25,000 annually, depending on household income and where you live, can make a huge difference for kids in schools and their ability to keep up learning. And in particular, here in the last year with the pandemic, where so many schools were doing only remote learning, we worked with our county. Even though I'm a city service, technically, we've been doing a lot of work with the county over the last year and trying to help them get prepared to roll out low-cost internet between our utility providers, our cable providers, but getting the devices into hands of these kids. I was flabbergasted at how woefully prepared we were to do something like that. The good news is the community rallied very fast, and we were able to get certain things taken care of. But those in Appalachia or rural America, I don't care what part of the country you're in, that don't have easy and, more importantly, cost-effective access to broadband internet or high-speed internet. I'll give you another, for instance, right now, since again, I do 1-1 numbers, 211, 311, back in the day, 911. If it's had a 1-1 behind it, I've had something to do with it at one time or another. And while 911 is hardwired into the country and phone systems, and even with next gen 911, it's being federally mandated that it's hardwired in. Things like 311 and 211 are not. So a lot of times what we're doing is we're setting up what we refer to as remote call forwarding, which is really, really simple technology and really easy programming, but it's kind of on the low tech side. It can be fallible. But what we were determining in particular with our social service folks was we were getting complaints, well, that number doesn't work. People aren't getting through. It's not getting answered. And I'm looking at it from my end going, well, sure, it's getting answered. We're doing just fine. We're answering it in 15 seconds or so. But what was happening, and we found this out through our health department, we have a very large Rwandan population here in Knoxville, Knox County. And they in particular were having trouble getting through on their mobile phones, smartphones. Well, what we have come to include, and as a matter of fact, there's legislation pending now to address some of this, is when it comes to these, what we call N11 numbers, so many people through COVID-19 with diminished income in particular, were getting rid of their data plans and calling strictly on Wi-Fi. And while when you're on a data plan, maybe you're getting through to these 1-1 numbers very easy, but when you're on Wi-Fi, depending on where you're at, it's very, very hit and miss. Senator Sanders, Senator Klobuchar, and I want to say the senator out of Pennsylvania have just recently introduced a bill, or actually they've sent notice to the head of the FCC to address this, because it's not just happening in our area, it's happening across the country. And it's probably going to continue for a while, even though we're slowly but surely crawling out of this pandemic. It's going to be a while before people are fully recovered. And again, a lot of these folks had challenges with technology before the pandemic ever started. This has just really magnified it. Also, just the cost of the devices alone can be exclusive for folks unless you've got programs in your area to tackle it. Next slide, if you don't mind. And the results of some of these things, the poor outcomes on a digital divide, you have educational disparity, diminished employment opportunities, and just simply the access to job openings when you have communities, civil service, HR, whatever, where their access to a job opening is, well, you need to go online, you need to pull it up, and you need to fill out this, and you need to fill out that, but you have to do it online. And people just don't have the access. We're going through that again right now with the new Treasury housing assistance program that's going on. We're partnering with our county. The county's actually the one that's managing it. But one of the things that renters that need assistance with rent and utilities, as well as landlords, the application is all online. So I may have the nicest people in the world in my call center, and I have a fabulous team, and we can help people find where to go and how to get assistance. But once they get online, or they have to be able to get online to fill it out. And a lot of people are like, I just don't have the access. I don't have a computer. I don't have a tablet. I can't do that. The good news is the county here was smart enough to get the libraries involved, and they opened up all the libraries, and the libraries have the tech to back it up. And they've taught all their help desk people on how to walk people through this. But those are some of the things to do. Treasury Department was very well intended. We want to get this money into the hands of people that need it. They've lost income through no fault of their own. They don't need to go through a bunch of counseling like you normally go through in the nonprofit world. And I can say that because I've worked in the nonprofit world for quite a bit, either through an agency or on a board, or I've been someone that donates to these organizations. And they do really, really great work, but their main function is trying to counsel people so they're not in the same position the next time. But we're dealing with a different population right now. We're dealing with a population that was probably doing everything right and still wound up in a hole. And the Treasury saw that and said, look, we want to get this money in their hands. We want to keep people housed. It's a lot cheaper to keep people housed than it is to try to rehouse them. So those are some of the challenges we're facing there. The limited access to aid on a regular basis, both social and otherwise, when you have a digital divide. Increased social isolation and poor mental health. We are seeing I don't want to say exponential, but depending on what part of the country you're in, we are seeing significant increases in mental health issues. This past year, knock on wood, it hasn't been quite so bad in 2021, but in 2020, here in Knoxville, Knox County, we had a rash of suicides over a short period of time. Shortly after we did the first stay-at-home order, a lot of people were trying to put two and two together and develop some causalities. There's always a lot more to the picture when it comes to mental health and suicides. But the bottom line is, you can see statistically that we have had increased mental health issues over the last year and a half. And when you don't have that access to people, either face-to-face or at very least digitally, for instance, I've got no less than 3 computer screens going on here in my office that have me keeping up with stuff. I'm a consummate multitasker, I can't help it. But I can only imagine, or actually I can't imagine what it would be like if I was cut off from all that, or if I didn't have access to it. In particular, if I'm in an environment where I don't have access to people face to face. Disenfranchisement of populations that were already marginalized, everyone from people of color to LGBTQ, to people with physical and learning disabilities, decreased productivity at work due to either lack or inferior remote access, poor health outcomes, transportation challenges, and in particular for senior populations here, what I do in 311 in particular, our target audience is primarily senior citizens, because those are people that really want to talk to somebody. They're not really big on doing the self-help options. And I learned a little bit about how this is. I had my mother living out here in Tennessee with me until she passed away. And I bought her a computer one year for Christmas with a Skype camera and everything on it. And she used it on Christmas Day to talk to her grandchildren and her great-grandchildren. That's probably the only time she ever used it. And I got really frustrated, tried to teach her how to do emails and stuff like that. And she just wasn't having any of it. And then one day I brought my tablet home, and she saw what I was doing on my tablet and couldn't get enough of it, because she could get on my tablet and get on Facebook and just swipe and look at pictures of the grandbabies. So it's kind of like, you got to figure out what works for people. The other thing is, most people, senior citizens, and I'm talking about the greatest generation. So folks that survived World War II, in some cases the Depression, although we're losing that generation very, very quickly now. But these are people that have been through a lot, are not used to asking for help to begin with. And so it's both intimidating and embarrassing for them. They also learned how to type on old typewriters, and that doesn't match what a keyboard looks like. So it's almost like having to learn how to retype over and over again. Smartphones are just too small. They have vision issues, cataracts, whatever else. And a lot of times with their hands, they're arthritic. So we've made these devices that are really great for people like you and me, but for our parents and our grandparents, not so much. And again, this gets blown up in an environment under COVID-19 when people are stuck at home. They're not seeing their grandchildren and their children. They don't get out. They don't make their medical appointments, which comes back to the whole poor health outcomes. They may not have transportation on their own, or they may not be able to drive anymore. They may not have easy access to public transportation. And last but not least, they're flat out scared to go in public. They don't want to be exposed. Of course, this is before the vaccine started rolling out at the pace it is now, but they didn't want to go out anywhere where they might get exposed, because they knew they were in a high risk population. And then last but not least, limited access to food. And last spring, about this time of year, there were big concerns in our community, and I'm sure everywhere else, that when we started closing down schools, our kids are going to miss out on what was probably the one meal of the day they really had that was nutritious. And again, I was very proud of this community. The Food Policy Council here in Knox County rallied around, and we worked with the federal government on some of the food programs to get some exceptions so these kids could get this food during the spring and then on into summer. But not everywhere around the country was that lucky. And in particular, some of the large metropolitan areas, it was much more challenging. Knoxville is what you'd consider kind of a mid-range city. We're a population of about 200,000. The county itself is probably a little bit closer to 750,000, but compared to Los Angeles, Chicago, Houston, New York, relatively small by comparison. Next slide, if you will. Some of the challenges, like I said, children in lower income areas are at a disadvantage. I said 63%, 62% of households of less than 30,000, while 90% of households between the 50 and $75,000 range have high-speed internet access. Senior citizens, they're on fixed incomes. They have limited access to learning opportunities, in particular now with so many senior centers closed or with limited access. Physical challenges, again, like I mentioned before, with their eyes and their hands. Some of our workforce challenges, connectivity to actual work. It's not just being able to connect by phone or by computer, but being able to access a work order or asset management system or a payroll system or things like that. And then so many places we're having to completely either invent or reinvent some personnel standard operating procedures for people to work at home. How are they going to be measured? How are they going to be monitored? How are you going to keep track of quality? How are you going to make sure people were actually putting in a full day? Things like that. So there have been all these ongoing challenges. Healthcare patients, once again, like I said before, a fear of exposure. Mobility and transportation are a huge one. Again, keep in mind, we're a relatively small city. While we do have a fabulous public transportation system, CAT, Knoxville Area Transit, it's limited to the city. So it doesn't take much for you to get out into the county, and people have limited access to that. I grew up, again, like I said, in Los Angeles County, and between RTD and OCTD, which was Orange County Transit to the south, there's public transportation to get just about anywhere. I found that out the hard way when I had my car stolen one year while I was a paramedic and had to ride the bus for a couple of weeks just to get to and from work. And I had to go from one county to the next. Well, I was very spoiled because where I lived, there was plenty of access. Here, not so much. People with disabilities, including learning disabilities, formatting, just the sheer cost of devices and access to data plans, things like that. And last but not least, our English as a second language populations. Immigrants who may fear the government due to immigration status, real or otherwise, whether or not they have a reason to be afraid. So they're afraid to access services, and they're afraid to access them remotely. And we get a lot of those, again, through our health department. We have a pretty large Spanish-speaking population here, but we have a very large Rwandan refugee population. And we had an experience where last year, about midsummer, when things were really peaking, one of their elders passed away. And of course, they were in isolation at the hospital. And people don't understand the cultural differences. And our healthcare workers were already inundated and buried and trying to multitask and do as best they can. But what they did not know was there is a tradition with this group of folks that someone needs to be there to hear that person's last words before they pass away. And that didn't happen. And the entire population, which was, a couple of apartment complexes worth, was in an uproar. And then they weren't trusting healthcare workers. They weren't trusting the government because they just assumed that we were trying to close them off and we weren't respecting their traditions, when in reality, nobody knew it. The bright thing that came out of that was one of those folks who was very fluent in English and very community oriented, wound up getting hired by our local community action committee to work with our refugee populations and making sure they have access to services. So it would have been better if we'd have been able to find this guy before that. But the good news is we've had great success reaching out to that population ever since. Next, please. Some more challenges. Again, I mentioned the broadband access. I see it a lot here in Tennessee when it comes to the rural communities. Our senator here in Tennessee, Marsha Blackburn, broadband access is a big issue for that office. They campaigned on it. When you get outside of Knox County and you get further into Appalachia, there's a huge challenge getting people connected. Security issues, personal information and identity theft. And it comes back to trying to work at home and doing more things at home. Employer data and malware. We got hit with a malware attack like so many other cities last summer. And we rolled with it fairly well, but I'm here to tell you, it made it difficult for about a month and a half, because our policy is, we don't pay these people off. So we just had to gut it out and kind of rebuild stuff as we went along. I think we have a much better security system now, but it was a challenge. And with more people working remotely, the more you've got data going across more highways, so to speak, there's more chances for things to get stolen and get picked up. So companies and governments have to plan for that stuff. The sheer cost of devices, like I said, and the cost of data plans, and I've already talked about the issues that people were having when they were ditching their data plans and going to strictly Wi-Fi calling. Information overload, and this is a big one. There are so many choices. There's so much information. It's almost impossible to wade through it. And again, I want you to put yourself in the shoes or the mind of the greatest generation, somebody in their 80s to maybe in their 90s, that were used to FDR on the radio, and then maybe network television with 3 networks. And now you've got hundreds of channels on the TV. You've got all this internet, Facebook, Twitter, TikTok, you name it. And all these choices of information and getting constantly bombarded with information. And then, of course, our last president coining the term fake news, because there are so many outlets out there that are propaganda arms for a certain group with a certain agenda, but they want to look like a news organization. And in reality, I get emails like this all the time. It'll look like a headline, and if you go to it, it's basically just somebody trying to, sell camping equipment or who knows what. So there's just so much out there. And the other thing, I've got a theory on this, and I was looking. I'm a psych major. That was my industrial organization was my degree at UCLA. So I'm constantly thinking about, okay, how do people think through some of these things, and how do we approach it? For so many years we had agricultural society, and then we had, the industrial age, the iron age, the locomotive, the steam engine, but this technology and machinery has advanced so far, so fast. Now, remember, when I was a kid, it was a big thing just to go to the moon. Now we're watching video from Mars. We had space shuttles going back and forth. We've got a space station circling overhead. The internet wasn't even a thing when I was a kid. So there's so much information, and there's so much going on through people's minds. I gotta think that there's a correlation there when we start talking about some of these mental health issues. I think genetically speaking, we're only capable of handling so much information at a time, and we are all getting pulled in so many different directions at so many different hours. The more we try to make things, it's those unintended consequences. The more we try to make things to make our lives more convenient, it seems like we wind up working more and harder and faster. And one of these days when I retire, I will sit down and really dig into that and maybe write a few articles and see if everybody calls me crazy, but we'll take it from there. If you don't mind, the next slide. So what's needed? Well, next slide, please. It's funny you should ask. The obvious answer is money. But I am not one of those that says you got to throw money at every issue. But in reality, we've got infrastructure issues. We've got infrastructure issues on the internet superhighway, security. We are constantly being attacked from outside. I'm preaching to the choir, in particular with this group, when it comes to security concerns. But there is so much going on. There's no getting around the fact that things cost money. And if we're going to help those that have limited access, somehow or another, we've got to make that more affordable. And it's going to cost money to do that. Improved access to devices and data, new work environments. And when I say work environment, I mean just where you're at. For instance, I'm in my office right now at my desk. I'm very comfortable there. When I have my day where I'm working from home, I'm not very coordinated because I'm trying to set up my computer and my screen for a Zoom. Maybe it's in the kitchen, or maybe it's in the TV room, or what have you. It's just, I'm at that age where that's just not the norm for me. So I'm having trouble adapting to it. Training, retooling our workforce to be able to work the way we're working right now and still keep up with everything we were doing a year and a half ago. Personal as well as corporate data, and how that data gets from point A to point B, and is it secure, and is it fast enough? Can I get access to the data I need? Like for instance, this morning when I was getting ready for budget hearings, I needed to make sure that I could get into all our documentation online that showed our line item budget, our capital requests, and anything else that we may need to talk about this morning. And I put this in capital letters on purpose because it has really come to the forefront, and it's one of the things I'm proudest about here in this community. But the need for collaboration and creative partnerships. I hate to use that old term, thinking outside the box, but we really made ourselves and our partner agencies think in different ways about how we accomplish certain tasks. I sit on many different task force, from our emergency management agency to our food policy council to our senior services council, or the mayor's homelessness initiative, you name it. And the way that we have been able to network those folks and look at different ways to deliver service, to deliver, for instance, volunteer opportunities, or to make sure food's getting where it needs to go. I was really proud. I have a data dashboard on the 211 side, which is the social services side. It's called 211counts.org. Any of you can go to it. It's free. You don't have to download anything. You don't have to agree to anything. 211counts.org. It's run through Washington University in St. Louis. There are partners on it. And they have helped us create a data dashboard on social services. And I just recently finished getting the rest of the state of Tennessee and our 211s connected on it. There are states all over the country that are on it, from Florida to Washington State. And it's interesting because you can look at the needs that are coming up in the different communities over time. You can see the trend. You can break it all the way down to zip code, legislative district, you name it. And one of the things I was really proud of with this community is, while we did have a little bit of a bump last year in food needs, especially right as schools were closing down, for the most part, food was one of the lower needs in this community. You know, we had the rent assistance needed, we had the household assistance, utility assistance, things like that. But unlike most communities that I was looking at on that dashboard, food requests in this community were only about 2%. And that was a direct access. We've got a great proactive food policy council, our mobile meals group. We had another group that was doing shopping for people that were quarantined and making sure that they were getting their food. The community really rallied on that one specific topic. And those numbers have stayed steady throughout the year. And I'm watching them in other parts of this state and in other states, and that has not been the case. There are a lot of areas that have been really challenged with that. Last but not least, there's got to be the political will and the leadership to make some of the changes and improvements needed to make sure we're not leaving anybody behind, and to make sure we're not leaving low-income households behind, people with disabilities, both physical and learning, people of color, LGBTQ, our senior citizen populations, our refugee and English as a second language populations, so that we are taking all those things into account as we move forward. And again, as I said, even though I put Ben Franklin up there on the screen, because inevitably you do have to spend some money, but it's not all about money. A lot of it is in how you approach partnerships in government, your non-government organizations, your NGO groups, your nonprofit groups, your local chambers, your school systems, your healthcare systems. There is so much networking and coordination and collaboration that needs to go on, that in some communities, they are rocking it. I get to see, I'm on the National 211 Steering Committee, as well as a national group for 311, and I get to see what other communities are doing. And I got to tell you, there's some great work going on throughout the country. I'm proud of our community, but there's awesome work going on all over the place. Next slide, please. These are just a handful of just some successful projects that I've watched over the last couple of years going into the pandemic and then during the pandemic. One of my personal favorite is the municipal kiosks that New York City rolled out a couple of years ago, so that people can have access to the internet just on the sidewalk. There's pros and cons to that when you're giving people that easy access, making sure they're not accessing things they shouldn't access, making sure that you've got proper security in place. But I think it's a great idea for making things accessible to people literally just walking around the community. Expanded use of our senior and rec centers as information outlets, as technology outlets or technology loaning areas, or where people can go use them. Expanded Wi-Fi locally. Some communities are better than others. Our community and several others are using our buses and our bus stops as high-speed Wi-Fi stations so that people can get access to it. Loan tech programs like at Texas A&M University. I'm not an Aggie. This is not an advertisement, but they have got a real interesting system set up where people can borrow or check out tech devices like they would a book. And then, of course, expanded mobile devices for our school. Those are some of the things that people were already working on before the pandemic ever started. But there's much more to be done, and people are working on it as we speak. There's probably 2 or 3 new good ideas that have come out just while I'm sitting here yakking at you. Next slide. So this is where I kind of turn the tables. So, instead of like the normal standard Q&A session, and I'm glad to answer questions if I can. I always tell people I'm an operations guy. I'm not what you'd consider an expert in any given field. But I do understand how things should work for people. I'm that guy that drives our tech group crazy because they come out with these really great ideas, and I'll sit here and play with it and go, yeah, but does it work for the person that you want it to work for? Does it do what you think you want it to do? I'm really happy with the group we had that just helped us roll out our last couple of projects because they've really listened to those kinds of things. But with that, if there are folks, and I'll let the folks in the control room, if they want to put it in chat, if there are people out there that have projects that they are working on that they think are worth noting, share. If you've got a question, I'd be happy to answer it. And with that, I will turn it over to the control room, I believe.